Let's be candid. The real reasons why some insurance agents despise Medicare Advantage. Should you be worried? Today, we're going to find out. Hi, I'm Chris Prang, the Medicare analyst, licensed insurance agent based out of Charlottesville, Virginia, and licensed in other states as well, which you will see at the end of this video. If today is your birthday, then happy birthday to you. So let's get into this. The number one reason why insurance agents, even like myself, have issues with Medicare Advantage is that there are so many companies to deal with. Take a look at the list here. This is a partial list. We've got Humana, Aetna, United Healthcare, Cigna, Centene, Anthem, which is now Elevance, all the Blue Cross Blue Shields, Kaiser, Molina, etc., etc., etc. Some very large companies that you see there, some small and even smaller ones available depending on where you live. Whereas with Medicare supplements, while there's many companies, we don't need to deal with them all. There's really only a handful of companies as agents that we need to deal with. Number two, ridiculous marketing rules for Medicare Advantage plans as well as for Part D plans. So every year as agents, we have to go through a national certification put on by a couple organizations. It basically regurgitates the same thing over and over. It's rather time consuming. There is a fee for it. And quite frankly, every year it is just flat out unnecessary to do. I understand doing it the first time and maybe having a refresher every few years, but that is about it. Then on top of that, we have to have an annual certification for every single one of those companies that you just saw listed if we are going to represent and sell those plans to people like you. So it's time consuming and it can be a bit costly. And now, because of all those wonderful TV ads that you have seen and all the heartache and trouble that they are causing, I have to read what's called a TPMO disclaimer to you, third-party marketing organization disclaimer to you when we talk on the phone, basically letting you know that I may not sell every plan available in your area. And if you need more information, call 1-800-MEDICARE or go to Medicare.gov. I must collect what's called a Medicare scope of appointment. This is a required document for me to go into plan details. I cannot go into plan details technically until I have had the scope of appointment signed by you, giving me permission to talk to you about Medicare Advantage or Part D drug plans. And technically, again, starting in the fall, I'm going to need that 48 hours ahead of time. Now, I do think this is going to protect people on those big 800 numbers, but there are unfortunately ways around it that people will take advantage of, but it's unnecessary. If I want to talk to you about Medicare supplements, long-term care, annuities, life insurance, or anything else, I don't need a scope of appointment. I don't really have any marketing rules that I need to abide by. So that is an issue for some agents. And now, again, because of all those TV ads, I have to record all my enrollment calls. So if you call in to me, if I call out to you and we're doing enrollment, I have to have that call recorded. That's such a big deal. It is a little bit cumbersome, but that is one of the things that as agents that we don't want to deal with. When it comes to Medicare supplements again, long-term care, annuities, I don't need to record the phone calls. My issue with this is I have a personal relationship with many of my clients, and we discuss some things that is nobody else's business. We may be going over the plan, but other conversation develops. So it's not just purely business. There can be personal things. I don't know who's going to hear those phone calls, and they should get rid of that, in my opinion. But that's one of the things that we have to deal with. And then, of course, we have to thoroughly review plan benefits with you. Now, that's a good thing. But the issue is, as we're going to see, when it comes to Medicare Advantage, there are so many Medicare Advantage options where really there's only 2 to maybe 3 Medicare supplement options, and they're all the same from coast to coast, which we will see here coming up. Number 3, Medicare Advantage plans are not standardized. Therefore, they are more varied and can be more convoluted, whereas Medicare supplements are standardized. And what that means is basically a Plan G is a Plan G from coast to coast, except in a handful of states where they vary a little bit. But if you get a Plan G in California, you get a Plan G in Virginia, they are the exact same coverage. The only thing that is different is the premium. There's only a few plans to pick from. And in my opinion, it's Plan G, Plan N, and maybe for a small percentage of people, what's called the high deductible Plan G. While there are technically 12 Medicare supplement policies to pick from, there's really only those 3. And again, they're the same thing from coast to coast. Medicare Advantage plans, though, they vary From county to county, there are dozens in each state, and as you will see here in a second, there are literally thousands of Medicare Advantage plans across the country. So trying to wrap that all into our brains is not the easiest thing to do. And when an agent is licensed in multiple states, it gets very difficult to deal with. Whereas Medicare Supplement, I don't care where I'm talking to you from in most of the states. I can talk to you very easily about Plan G, again, in California or Florida or Virginia. It doesn't matter because it's the exact same coverage. When it's Medicare Advantage, again, it varies from county to county, and that's the way Medicare Advantage works. You could live in one county here, you could have a neighbor across the street in a different county, and they could have different Medicare Advantage plans, or even different companies selling Medicare Advantage plans. So as an agent, that gets difficult. Number 4 reason why insurance agents don't like Medicare Advantage plans are the unethical and misleading marketing practices from the large organizations. You know, all those ads you see on TV, maybe flyers you get in the mail. I'm not talking about the insurance companies. I'm talking about the big brokerage houses and these big firms and these big companies that sell Medicare Advantage. They call you on the phone, they send you flyers in the mail, they got lots of advertising, as you have seen. You can see my video, warning, don't be fooled by Medicare ads on there. Number 5, plan networks. When it comes to original Medicare and Medicare supplements, there are no networks. About 97% of all providers take what's called Medicare assignment. That means you can go to just about any doctor, any hospital you want. You pay the same price regardless because there is no network at all. When it comes to Medicare Advantage, they do have networks. Some are very limited, so you need to be careful, and some are very vast. And they can change at any time. You could be going to your doctor and he could be in the plan's network, and the next time you visit, for whatever reason, he can choose to be out of the network. And it does happen, so you need to be careful. The truth is, if you choose the right plan with a company that has a large nationwide network, then typically it's not too bad. The number 6 reason that we struggle with Medicare Advantage is what are called prior authorizations. So what is a prior authorization? Let me read to you. Quote, certain procedures, services, and drugs may need advance approval from your plan. This is called a prior authorization or pre-authorization. Please contact your primary care physician or refer to the evidence of coverage for services that require a prior authorization from the plan. So when it comes to original Medicare, and of course then your supplement, it is less likely to require a prior authorization. But believe me, as I will show you here, there is still a long list of services that must, under original Medicare, that must have a prior authorization. But under Medicare Advantage, what can happen is it can hold up a procedure possibly being done, and it could also cause a denial of claim. Fortunately, CMS is making changes that will reduce prior authorization. Truth is, if you understand that you may need a prior authorization from time to time and discuss with your provider, then usually it gets worked out. If you take a look at this survey from eHealth, now you might want to take that with a grain of salt, but you will find that overall 13% said they have had a claim or pre-authorization request denied. 43% of those who had a claim or pre-authorization request denied say they were informed that it was excluded from coverage under their plan. And there's some other information as well. But if you understand that you may need one from time to time, then again, it's usually not that big a deal. But if you don't want to deal with any chance of a pre-authorization, you could have it under Medicare supplements and original Medicare, just not as likely, then you need to take that into consideration. Number 7, co-payments, out-of-pocket costs, claim denials, and medical bills. So most Medicare supplements have very little out-of-pocket costs. If you get a Plan G, you've got one responsibility, and that is to meet your Part B deductible. If you get a Plan N, you got to meet your Part B deductible. You may have a copayment of up to $20 for certain office visits and up to $50 for the ER. And then that's about it. Plan N, you could possibly get some excess charges. Again, would only happen with 3% of the providers out there. Medicare Advantage, however, almost always has copayments that you're going to have to deal with. You go to the doctor, you go to the hospital, get an x-ray, get an MRI, you're going to have copayments that you're going to deal with. So there is an annual maximum out of pocket, protects you from going too high, but they can vary from being relatively low to being relatively high. So you need to check what your plan is, or when you're considering Medicare Advantage, that you understand what you are on the hook for. This is called your risk exposure, your financial risk exposure. In the event of something serious, what is the most in 1 year I'm going to have to pay out of pocket? Number 8, customer service. Medicare Advantage clients can be more hands-on. And for all my Medicare Advantage clients, you are always welcome to call me. But because of the nuances with Medicare Advantage that I've already mentioned, there is a greater likelihood that a client will call with questions and need more help navigating their plan. Now, as agents, we do want to help our clients. We want to be there for them. So I'm not knocking anybody that is an agent that has an issue with Medicare Advantage. This is just one of the things that more than likely we're going to have more customer service for people that have Medicare Advantage compared to a Medicare supplement. But I can tell you, in my 13 years and my several thousand people of dealing with, I don't get that many calls. Now, that could be because I try to do a pretty thorough overview and presentation and ask the questions to make sure that people understand what they're getting and that it is well suited for them. I go over all the pros and cons. When it comes to Medicare supplements, as agents, typically one of the phone calls we get is, my premium has just gone through the roof, and how can I get it lower? Or they're calling and say, hey, I need to recommend a friend to you that wants to get some Medicare help from you. That's about all we have to deal with when it comes to Medicare supplement clients. So they call when their premiums go up or when they have a referral to pass along. So what do you think? Does this make you nervous at all? Let's discuss some of these. Number 1, let's talk about networks. So if you work with a good agent, hopefully like myself, that reviews your doctors and you understand how networks work and which providers are in and out, that will be helpful. Ideally, what you want to select is a large national Medicare Advantage company that has a large nationwide network. Number 2, prior authorizations. So these have, seems to me anyway, have become more common. Again, CMS is working to limit on how those are taking effect where it's not holding up services and people are being covered. But you need to understand if that they exist and how they work. If you have a chronic condition and you have a chance to get a Medicare Advantage plan and you're turning 65 or a Medicare supplement, then you may want to consider a Medicare supplement. It really just depends on where you live and how advantageous the Medicare Advantage plans are in your areas. And remember, CMS is working to make prior authorization situation better. If you take a look at this, cms.gov for their contract year 2024, this was their initial proposal. They said CMS has received numerous inquiries regarding concerns about the use of prior authorization by Medicare Advantage plans and the effect on beneficiary access to care, including recommendations from the Office of the Inspector General. In the rule, CMS proposes impactful changes to address these concerns to ensure enrollees have timely access to medically necessary care. They went on, the proposed rule also would streamline prior authorization requirements, including adding continuity of care requirements and reducing disruption in ongoing care for beneficiaries by requiring that when an enrollee is granted prior authorization approval, it will remain valid for the full course of treatment. And then in their final decision, they came out and said the final rule also streamlines prior authorization requirements, including adding continuity of care requirements and reducing disruptions for beneficiaries. CMS's final rule requires that coordinated care plan prior authorization policies may only be used to confirm the presence of diagnosis or other medical criteria and or ensure that an item or service is medically necessary. They are working on it. So hopefully in the future, prior authorizations won't be too big of a deal, but they will still be around. Number 3, let's talk about co-payments, out-of-pocket costs, claim denials, and medical bills. I don't know why this is such a big thing, because for most people that are on Medicare at some point in time, they had a major medical policy that had all of these things, had co-payments, had deductibles, had a max amount of pocket that they had to deal with, probably had prior authorizations as well. So the key is, what you want to do is you want to answer questions about your overall health and how often you go to see a doctor when you are choosing between a Medicare supplement and a Medicare Advantage plan. In my 13 years of experience, again, I have found that most people save money over the long haul on Medicare Advantage plans. Not everybody, but I would say that most people do. They may incur 1 year where they have a lot of money out of pocket, but the next remaining years or the years before, they didn't pay so much out of pocket and they took advantage of the savings and the benefits that they got. So when you work with me, what we do is we answer the important questions, determine if it's safe and prudent to choose a Medicare Advantage plan or to go with a Medicare supplement. Whatever is in your best interest and desire, that's what I want to help you with. Important. So when choosing a plan, you should consider the future. Accidents happen and your health can change at any time. That's very, very important. It is easy to go from a Medicare supplement plan to a Medicare Advantage plan. But if you have health issues later, it will be difficult to get a Medicare supplement. Number 4, let's talk about customer service. Number 1, my advice, never deal with one of these ads that you see on TV. Good luck when it comes to customer service. Now, you go directly to the insurance company, whoever you got it from, hopefully you're going to get good customer service. But one of the values of a good agent is advocating for you in the event that you have an issue or answering questions they can't answer. I'm going to give you, here's a really good example that I'm thinking of right now when it comes to Medicare Advantage. Let's suppose you need to go see a doctor. You go online to that insurance company's website and you try to look up and see if that doctor is in the network. And you discovered that the doctor is not listed there. So you assume that the doctor's not in the network and you can't go or you got to pay more money. You may even pick up the phone and you may call the insurance company. And what they're going to do is they're going to look at the exact same resource that you looked at and they say, nope, Mr. Jones, Dr. Smith is not in our network. Well, that may not be true. And I've had this happen plenty of times. So I tell people, if you need to see a doctor and you don't see them showing up in network, or you call the insurance company and they tell you they're not in network, before you do anything, you call me. Because what I will do is I will reach out actually to a provider relations team that has the full and real list of providers that are in that plan's network. And most of the time, they're actually in the network. Not every time, but most of the time, they're in the network. You are not going to get that from one of those 800 numbers. So keep that in mind. Ideally, you should avoid going direct straight to the insurance company as well, because when you do that, you're dealing with one insurance company and they can't sell you somebody else's. They can't tell you the pros and cons of the competition. They just can't do that. Be very careful, unfortunately, with this one of dealing with local nonprofit organizations. They will not be there for you when it comes to customer service. Basically, what they do is you come in, you give them your medications, maybe you're telling your doctors, they look stuff up. They can be very biased. They can be unbiased. It just really depends. But they will not be there for customer service. They do not understand the ins and outs of Medicare, Medicare Advantage, the drug plans. They don't necessarily answer or ask the questions that they should ask. So be very careful. Ideally, you should deal exclusively with an independent agent that represents numerous insurance companies and specializes in Medicare and has been doing it for a while. If you understand Medicare Advantage and how it works and are aware of the positives and negatives, then you are less likely to have an issue. Plus, number 1, you will have access to extra benefits that would have cost you hundreds, if not thousands of dollars if you had to pay out of pocket or purchase another policy to cover you. Example, many of the Medicare Advantage plans cover dental, many into the hundreds or thousands of dollars every single year. That could be a great benefit to somebody and could save them lots of money over time. You could possibly have better healthcare outcomes because Medicare Advantage is more managed care. You have nurses calling you, reminding you to get certain services done. Things like your flu shots, your cancer screenings, and things like that. And you may save money over the long haul. So what should you choose? That's the big question, isn't it? If you want something simple, predictable, easy to use, with no thrills, but with higher and escalating premiums, then choose a Medicare supplement and be happy with your choice. If you have good to excellent health, you are in an area where your Medicare Advantage plan has a low maximum out of pocket, you understand how the Medicare Advantage works, you're willing to deal with some negative aspects with the intent to save money and take advantage of the extra benefits, then consider a Medicare Advantage plan. Let me give you a little tidbit on some of my clients that have Medicare Advantage. A number of years ago, I worked with a doctor and his family and a bunch of people that he brought to his home. He was a doctor. He was on the board of a large mid-Atlantic health insurance company that in the past number of years has got bought out by one of the big companies. He chose Medicare Advantage for him and his wife and his friends as well. Another client who is a doctor and was the medical director for a local hospital chose Medicare Advantage for himself, his wife, and his mother-in-law. I've had numerous nurses choose Medicare Advantage. And the reason why they typically do is they do understand how it works, but they have all these people that come in, all their patients, and they ask them what insurance they have, and they tell them they have Medicare Advantage, and the patients love it. So that's one reason why the nurses choose it. I've also had numerous clients told by their primary care physician that they should consider a Medicare Advantage plan. Next, if you have questions, if you need help, go to my website, themedicareanalyst.com, and you will see on there you'll see lots of information, but you'll see a couple contact pages. You can reach out to me, schedule an appointment. If you happen to live within about an hour or so of the Charlottesville, Virginia area, and you would like to meet in person at a safe, convenient location, then contact me and we can probably work that out. States that I'm currently licensed in: Virginia, North Carolina, South Carolina, Florida, and Tennessee, with more states coming soon, which here's where you can do me a favor down in the comments section below. Please put the state that you are watching from so I know, so I can kind of keep track and I see where people are watching from, and then I'll start getting licensed in those states. If you like, and I hope you have liked the information here, please like the video. Please consider subscribing for more future content. And if you know somebody that can benefit, then please share the information with them as well. If you have a question, then reach out to me either through my website. You can put it in the comment section below. If I don't respond in the comment section, then send me a contact question through my contact on there. So that's it. Those are some of the reasons why insurance agents do not like Medicare Advantage. I hope that was helpful to you. I'm Chris Prang, the Medicare Analyst. Make it a great day.